Thank you for giving me this opportunity to speak with you today, and the excellent panel members who outlined the issues and sort of gave a background. What I want to talk today is more about policy, how policy is made, and policy influence, and where policy needs to change, or how it can change. Putting people first is the title of the conference, and I'll stick to that. So the background information, or the things I'm saying, the information comes from NACOSA's programs, and I'll explain some of that later. CASE, the Community Agency for Social Inquiry, was a research NGO that did extensive research throughout the transition in South Africa, but this was applied research in poorer communities. We sought to inform public policy from the perspective of poorer individuals and poorer households, and did this through large-scale national surveys and all other forms of research as well. The policy work that informed, and the policy work that I've been engaged in, essentially focused deeply on the conditions under which poorer South Africans live. The social and specifically coming to this, it gave me an understanding of the screen's gone blank. Sorry. The socioeconomic conditions of the Pewood community. So understanding the conditions under which the Pewood community lives, who they are, where they come from, what shapes their lives, what shapes the drivers in their lives, and how that can influence policy is where I'm coming from. And lastly, the historical nature of policy evolution in South Africa, because as the speakers have pointed out, the kinds of policies we have, nobody sort of woke up one morning and said, I think this is the way we should go. These policies have evolved, and there were major drivers. I think one of the drivers, the economic system that drives the kind of policies that we have, who's getting rich by the kind of policies we have, the pharmaceutical industries, COVID, and the vaccine, and the money that was made out of the vaccines, and the extent to which vaccines were even made in Africa, but not available to Africans. All of that insight as to who's making money, what kind of economic system we're having, and how is that impacting on the problems that we're having is also an added sort of lens, apart from the racial aspects that were covered by the speakers. So the history for me of the economic system and the drivers of that. Briefly, these are our programs, and essentially our programs are driven by HIV and AIDS. For our harm reduction programs are in KZN, in the Western Cape Province, and in Gauteng. So the basic outline of what I want to talk about is how colonialism, and in the South African context, apartheid, continues to define the legislative and policy frameworks within which dependency on harmful drugs, on drug use, is managed by governments. And I want to suggest areas and make some suggestions on how the policy process can be improved. In the opening plenary, some of the things I said was the role of civil society, the role of NGOs, how in this country and across the world we've seen less and less involvement of organizations that are actually working amongst poorer people, amongst affected communities in forming policy. We handed a lot of the power over to our governments, our democratic governments, especially when the change came in South Africa, and it was very stark. Previously, NGOs and social movements always had policy and research going as part of their work, but today it's hard to find that kind of resource. Where I'm going to, sorry for the spelling error there, it's the criminalization of marginalized groups. And when you look at the Pewood community, when you look at sex workers, when you look at shack dwellers and informal settlements, and when you look at street traders, all these communities are criminalized. So, you know the saying, if you're a black man, you're born as a criminal. Or if you're poor, you are a criminal. But in these communities, in the work that I've been doing over the years, supporting street traders, and we know how essential they were. When there was a hard lockdown during COVID and there were no street traders, the food chains in poorer communities collapsed. That led to looting and wide-scale rioting. There was no food to be found. Street traders were so integral. Yet if you go around Cape Town, especially in the City Bowl, no street traders, except for the posh ones that are selling things to tourists. But actually people trying to make a life out of it, it's made illegal. Shack dwellers and informal settlements, they're huge shacklands in Cape Town. You see them as soon as you land at the airport. And the extent to which informal people who are trying to build homes for themselves, the routine demolition of shack dwellers, and their lives are criminalized. Sex workers, I think other colleagues who were here and Sisonke and organizations like that can speak much more eloquently about that and the extent to which sex work is criminalized. And I won't talk about the Peawood community because you are experts in that field. So all the above communities are constantly and routinely coming into conflict with the law. If I wanted to trace the evolution of policy and legislation, the criminalization of poorer black youth in the USA and the Black Lives Matter movement, the speaker spoke about that, Colleen, when you started. And essentially all the research and the writings of people like Angela Davis talk about how slavery has essentially morphed into the prison system in America. And there's the abolitionist movement, which says we actually need to get rid of these prisons. If you look at the prison populations, in the general population, about 12% are black people or people of color. But in the prison population, that figure is about 30%. The chances of a black youth winding up in prison is something like 5 times higher than a white youth in America. So the entire Black Lives Movement, the movement that happened and the killing of Floyd and people like that, a lot of that was covered in the press. And I won't go too much into that. I think the opium wars were mentioned and how Europe traded with China. The wars currently in Afghanistan, Pakistan, Mexico, those are all wars supposedly, but we know what has happened to those regions. Here in South Africa, if you look at alcohol and alcohol fetal syndrome, you have lovely wine here in Cape Town, lovely winelands, but who owns that land? Where's the money being made? If you start to understand all of that, you'll see how money, rich people, and people who, and where that, the money is going to. In South Africa, we had an added complication. We had grand apartheid and the creation of Bantustans, and KwaZulu-Natal and Transkei were sort of holding areas where migrant workers would serve the mines in Johannesburg and in the Free State, the gold mines, and also the industrial areas of the metros. And there was no economies in these poorer areas, and cannabis played quite a role in poorer households in these rural Bantustans. But if you look at how the cannabis industry has grown now, those households, those families, those communities, those farmers are nowhere. CBD oil, the entire marketing of it. So follow the money and see how drugs, how legislation, how trade and industry policy is actually not focusing on where poverty, inequality, oppression, and it actually feeds the existing economic systems, the existing races that actually own and control the economy. That was at a national level where you had the Bantustans and the provinces. In the cities, apartheid cities and the cities were much more controlled. So Cape Town is a city there's huge urban ghettos, extensive shacklands, and fabulously rich Atlantic seaboard. If you wanted to buy a house on the Atlantic seaboard, you have to have dollars. They advertise the prices of those houses in dollars. You can't buy them in rands, simply put. The entire city bowl of Cape Town is not owned by South Africans. It's owned by foreigners. Sex work, drugs, and violent gangs, and the extent to which the ghettos in Cape Town, someone also spoke about the intersection between violence, gangs, and it's so evident here in the city where we're having this conference. So coming back to this and trying to understand policy, at NACOSA we're trying to be putting people first in the work we do. And the first place we started was with our values. So we value others by listening with empathy and responding with care. We recognize and respect the agency, dignity, and strength of communities and people. So the work we do at NACOSA is, and how do we sort of build this into our work? And I'm trying to move towards saying what are the policy implications in the way that we formulating policy. We facilitate networking and collaboration with organizations, movements, donors, government institutions, and business at local, national, regional, and global levels. So this bringing together of a wide range of people to actually focus on issues, but led by communities of peerhood, that would be the core of making policy. Building networks to consolidate a collective voice and build a collaborative, broad-based community within the public health ecosystem as NACOSA, but you can read within the peerhood ecosystem. And then advocate, learn, and share collectively through consultative forums, local planning and coordination, community-led service monitoring, community dialogues, sharing, learning, and advocacy. So that's what we try to do, and what we hope to achieve is to shift power. We want to shift the dominant organizational culture, build on collectiveness, and ignite strategic partnerships with organizations and the constituency of peerhood in the way that some of my colleagues, Yolan, are running programs that we're running at NACOSA. We want to transform this ugly competitiveness into compassion and reflecting this in our engagement and communication with others. So for us then, decriminalization is a key policy that we need to drive and would be wanting to support as NACOSA. And how would we do that? We think strengthening the community of peerhood to be involved in policy and legislation process, and so building a network of organizations and supporting that network is something that we'll be very interested in doing. Recognizing that poorer drug users have the complication of poverty and in extreme instances, homelessness. It's been written about that, remove homelessness and you'll deal with drug use for people that live on the streets. So this intersection between homelessness and drug use is very clear and stark. And so having an effort and the way in which all of this comes together is important for us. How will we do this? And I'll leave you with sort of 4 concepts. So using concepts like centering the margins, asks whether we're making the perspectives of people belonging to the peerhood community the central axis around which discourse evolves. It does require us to ask the question repeatedly as to how we would center the perspectives and understandings of the peerhood community in policy making. Digging beneath the surface of information to develop deeper understandings of concepts, relationships, and personal biases. In developing our policies, are we paying sufficient attention to what is actually going on in peerhood communities and individuals' lives? Ways of knowing that result from critical analysis of peerhood personal experiences, infusing storytelling and increasing qualitative reporting in policy development will be helpful in bringing out the lived experiences of peerhood. The policymaking process relies heavily on quantitative data, as you heard from the presentations. Things like significant change methodology relies on the story being told using the perspective of the person and organization in developing policy. It centers the experiences of the individuals and organizations in the policy framework. So what I'm asking for is a different process and a mechanism, different kinds of research that result in policy making. Stigma and our approach to stigma. Recognize the extent to which stigma towards people who use drugs impacts on the policy process. Drug use is stigmatized as a weakness amongst people and not as an addiction that a person is struggling with. Do we adequately recognize the stigma associated with drug use and how this impacts on our policies? The approach of harm reduction recognizes this. And so we group harm reduction in our stable of human rights work. Ordinariness, that the nature and existence of PWD amongst, for example, homeless people is integral and normal rather than aberrational. Recognizing and working with the concept that we do not live in a normal society is central to improving our policies. The levels of poverty, inequality, and violence in our society is not normal. Using drugs like alcohol, nicotine, and opioids is not normal when used in a manner that it disrupts one's functioning as an individual and contribution to society. We have become numbed by the poverty all around us and accept it as normal. Let us not accept that poor people who use alcohol and other drugs is normal. Thank you.
Thank you so much.